Welcome to the Performing Arts and Humanities Building at UMBC. At this time, please note the nearest emergency exit. In the event of an evacuation, please follow the instructions of your ushers toward one of these exits. Food and beverages, except for bottled water, are not permitted in pub venues. For the safety of presenters, please refrain from the use of flash photography. Thank you very much for your cooperation.
I'm allowed to take my mask off when I'm all by myself here, although we are indoors. So I want to welcome all of you to the fifth round of GridX here at UMBC. And I'm really glad to see that many of you in person here. We know we have a good number of people watching us remotely as well, and a welcome to all of you. I'm Carl Stein. I'm the Vice President for Research here at UMBC. And I think we're in for a couple of really exciting hours of listening to some of our faculty and of some of our alumni speak with us today. We conceived and launched GridX 5 years ago. And as you see above me, GridX stands for Global Research, Innovation, Trends, and Excellence. And it was for the 50th anniversary of UMBC. And unfortunately, it was such a big success that I was tasked to do it on an annual basis since then. I'm really thrilled, actually, that we can do that because there's so many exciting pieces of work, of creative achievement, of scholarship, and of research going on at UMBC that this is a great forum for us to share with you. Over the next 2 hours, we'll explore some of the most pressing concerns in our society today. We'll look at global land and culture conservation. We'll look at UMBC's unique role in global climate observations. And we learn about saving our environment from the past. We also will look at ways to track and combat pandemics, such as COVID, by learning about data dashboards, exploring connections between data evidence and policy, and it's looking at some remarkable chemical compounds called flexomers. But we will also be looking at the impact of human-to-human interactions, from personal connections for effective awareness to the challenges affiliated with multicultural parenting. So I think it's going to be a really exciting set of talks with us. So to kick off our first GridX session, here is Dr. William LaCourse. He is the Dean of the College of Natural and Mathematical Sciences. Please give me a hand to welcome Dr. LaCourse. There you go, Bill.
I'm always afraid when I take off the mask that I'm going to sound muffled, and my brain has taught it to be that way going forward. And the last time I was in this theater was just too long ago, right? And it was, people were here, there were ghosts flying around on stage. It was just fantastic. So I can't wait for the day we can see that again. So it's going to happen, right? So anyway, it's definitely an honor for me to introduce Dr. Leticia Gerasa, who joined Baltimore City government as the Commissioner of Health in March 2019. Dr. Gerasa, a Hopkins-trained pediatrician, believes that equitable care is a basic right for all and will tirelessly advocate programs that support the overall health and well-being of all Baltimore City residents. Dr. Gerasa's special interests include obesity management and prevention, trauma-informed care in children and adolescents, and expanded use of technology to improve health outcomes. Prior to joining the health department, Dr. Gerasa worked at Fearless Solutions. What a wonderful name. So, a Baltimore-based digital services firm that builds custom software solutions for local and federal government clients. In a role at Fearless as Health Innovation Officer, Dr. Gerasa was responsible for managing the health care IT portfolio for the company and provided clinical subject matter expertise to HIT projects. Dr. Gerasa also has close clinical ties to the Baltimore community, having trained at the Johns Hopkins Hospital for Pediatrics and having worked as medical director for school-based health and quality at Baltimore Medical Systems from 2013 to 2016. In addition to holding a BS from UMBC in biological sciences, Dr. Gerasa graduated from Meharry Medical College, summa cum laude, in 2007. She lives in downtown Baltimore with her husband and son. And just on behalf of UMBC, we are so proud of Dr. Gerasa. She epitomized the ethos of UMBC and what we strive to do and what we strive to be. And we will be forever grateful that she chose to be a part of the UMBC family. So thank you very much.
Good afternoon. Thank you so much for that very warm welcome. I am truly honored to be here. As was mentioned, my name is Dr. Letitia Gerasa, and I am the Commissioner of Health for Baltimore City. So before we begin, I do want to take a moment and just highlight the importance of events like GridX. Critical discussions like these happening among members of the community act as a catalyst for real and lasting change. So thank you all for having me here today. I'm truly excited and honored to be here amongst other alum. By being here today, you yourself are demonstrating a commitment to learning, which, as I'm sure you all recognize, is a collaborative effort. Coming together to solve the problems that exist in the natural world is truly the foundation on which UMBC is built, and I would know because I was a student here. So in preparing for this GridX talk, I was brought back to my time here as a student. So fun fact about me, I was a Meyerhoff Scholar, M11 to be exact. And during my time, I was also a bio major. So very proud of being a biology major while I was here. And I truly fell in love with biostatistics, biochemistry, as well as sociology. So by UMBC being so data-oriented, it really gave me that introduction into the nature of data. And I was able to carry that throughout my entirety during my academic journey and now as a professional. I've really saw firsthand the interdisciplinary nature of health, biological sciences, mathematics, and statistics. And it's using those tools of statistics that I was able to gain this critical knowledge about how we can answer some of public health, biology, and medicine's most pressing questions. So biostatistics, as I mentioned, truly became central to my academic and career trajectory because biostats required that constant gathering of evidence and evaluation in order to make a judgment or conclusion that was rooted in fact. And while biologists, biostatisticians, and data scientists can go in to use their quantitative skills to do just about anything, I use the knowledge that I gathered here at UMBC to guide my work when I went into pediatrics, when I went into health innovation, and now as the city's first African-American female health commissioner. So what I'm here to talk about today is how does data really guide us, especially when we think about equity in practice. So I've used data, as I mentioned, throughout my career. But I think what we saw with the pandemic is that data was used by everyone, right, in real time. So even from those very first cases of coronavirus in late 2019, we watched as pandemic data permeated popular culture. If you were to turn on CNN at any given time, you could see the national and global case count, death count, and vaccination rates just ticking away like a timer. This data has become a constant on the news and in social media. Rarely, if ever, have we seen health data reach the general public to this magnitude. And because of this, I believe that at local public health leadership, we had a heightened responsibility to communicate and interpret these figures to our respective community. And Baltimore City did just that with our COVID-19 dashboard, which launched in May of 2020. The orientation of our dashboard allowed us to really first identify concerns and trends in the data and then act, which at its very core is the nature of evidence-based learning and decision-making. Our dashboard was a success in demonstrating that we can not only share data of this sort in real time, but more importantly, it allowed us to provide the public insight into how policy recommendations are made in real time. When you look at this slide, I see a few things, right? So first you see this wonderful CSA map, right? And for those that don't know, CSA stands for Community Statistical Areas. And what we've been able to do with this map is identify CSAs within the city that have lowest vaccination coverage. When you see those small little orange dots with the needle on it, that represents mobile vaccination clinics that we've concentrated in areas of the city with lowest vaccination coverage. Now looking at the bottom right, you see a snapshot of our dashboard. So you see a very quick view This is public-facing, a very quick view of the cases in Baltimore City, of the deaths, of positivity, of the percentage of those that are eligible that have received a first or single dose of vaccine. You also see where where we are in terms of COVID transmission compared to what the CDC has said. So from an interdisciplinary lens, this allows us to think more critically, and we begin to understand data as stories and patterns that point us towards solutions. We see where we need to intervene. So in other words, data sets the stage for equitable interventions. After identifying a pattern of disparate outcomes, we begin to tailor our response to drive improved outcomes for the community that we serve. As I mentioned, our surveillance data was integral in driving our planning for both testing and vaccination clinics. One early example of this in the pandemic was in April of 2020. We begin to see high case rates in the 21224 zip code of Baltimore City. Now, for those that don't know, that has a very largely Latinx population. And so what we saw was that there was a significant need for testing for this community. And then when we got there and actually began testing, we also saw that there was a need for other support services. So we were able to partner with other like-minded community-based organizations to ensure that this community not just had access to testing, but also had access to food and groceries and money so that individuals that were key breadwinners for their family could safely stay home and isolate and quarantine while their family would still be provided for. We subsequently had other clinical partners come in and provide additional services within this zip code. And I think that was extremely important for that part of the city at the time. That's continued for us throughout the pandemic. So even now, we established something called our value ambassadors. And our value ambassadors are those individuals that focus on communities that have either been hardest impacted by COVID-19 or we knew had less access to care. We've got 10 value ambassadors in partnership with Morgan State University, to be exact. And they include communities like our young men of color, our Latinx community, or those living with disabilities. So the pandemic, again, allowed us to showcase how we in public health translate data into policy change, meaningful stakeholder engagement, and subsequent action plans. But most importantly, in using that data, it also allowed us to work closely with the community. So we say that we're data-driven and community-informed. It's not enough to have the data. It's extremely important that you engage the community that you're serving and you're working alongside. So even when we go into areas of the city that have high needs, we're constantly having conversations with members of the community, one, to try to explain the data in a way that they understand, but also to understand what their need is. And that could be different for every community. So it really is critical that we tailor our needs to, again, address the needs of the community. So again, the COVID-19 pandemic allowed us to use data, but it also further illuminated health and healthcare disparities in communities across the US. We need to continue to be data-driven and community-informed. We know that patterns and disparities need to continue to be investigated, interventions need to continue to be tailored, and priorities need to continue to be aligned with the needs of the community, all to advance health equity. And that all starts with you all here today. So hopefully something that I've said in this talk has sparked your interest in data and has also encouraged you to figure out what are the needs of my community. Yes, there's the data, but alongside with what my community is saying they need, how can I make a difference? How can I have impact? Thank you all.
Let's see if I can negotiate those stairs 3 times today. Anyway, it's my pleasure to introduce Dr. Kathy Seeley-Radke. She's a professor in the Department of Chemistry and Biochemistry. Her medicinal chemistry research focuses on targeting coronaviruses, maybe something we've heard about recently, including SARS-CoV-2 and MERS, as well as Ebola, dengue, yellow fever viruses, among other infectious diseases, using her nucleoside fleximers. She has been at UMBC since 2003 after moving her research group here from Georgia Tech. Among her many honors. Dr. Celia Radke was the 2015 to 2018 UMBC Presidential Research Professor, as well as the University of Maryland System-Wide Regents Professor for Creativity and Research. And in 2016, she was named Maryland Chemist of the Year by the American Chemical Society. In 2020, she was awarded the Antoine Holy Memorial Award by the International Society for Antiviral Research for her outstanding accomplishments and demonstrated service to the antiviral and medicinal chemistry fields. Dr. Celia Radke is also president-elect of that same organization, as well as a past president for the International Society for Nucleosides, Nucleotides, and Nucleic Acids, and a co-chair for the 2023 Gordon Research Conference on Nucleosides, Nucleotides, and Oligonucleotides. I'm fortunately a chemist, so these words come pretty easy. It's not always the case, believe me. So I'm going to date myself a little bit, and maybe you remember this as well. There was this old country song. It was a little while back, and it was like, I was country before country was cool. Well, when it comes to Professor Celia Radke's work, she was working on cures for COVID and COVID-related viruses before they were in the news. So a researcher ahead of her time. Thank you.
Thank you, Dean LaCourse, and thank you for the invitation, Carl, for me to speak here today. As the Dean mentioned, I've been working on coronaviruses for a number of years. Actually, we've been working on viruses for the past 2.5 decades, but started working on coronaviruses about 2013, 2012, when it wasn't popular, and when we were told by NIH study sections that, well, yeah, this MERS thing, it's just a small outbreak and it's never going to hit the United States, so we shouldn't really worry about it. Well, guess we're having second thoughts about that now. So I think as we approach the 2-year mark for this pandemic that we've been all suffering through, it's worth it to point out this isn't the first pandemic or outbreak that we've suffered through, nor is it likely to be the last. And I think that's the important thing I want you to think about today. And you can see here some of the different outbreaks that have occurred. And it actually, I want to point out the MERS outbreak. That's actually still going on. And so even though that was first noted in 2012, and then there was a second outbreak in 2015 in South Korea, and I actually happened to be there at the time, that was spread by one person, one super spreader. And now we've seen the effects of how fast a pandemic can actually travel around the globe because of the way we travel and how we interact with each other. And so, as Letitia pointed out a few minutes ago, we have had a lot of information available to us very rapidly, unlike in previous years. And I think one of the problems that has arisen is that people don't really understand how we treat viruses. As you know, there has been much talk about different drugs that came and went, antibiotics, anti-parasitic drugs, anti-malarial drugs, things like that. Those don't work against viruses. Vaccines definitely are important, but they're for prevention. They're not treatments. Steroids are useful, but they treat the symptoms, not the actual virus. They don't kill the virus. Monoclonal antibodies are helpful, and we're seeing a lot of those now being introduced. And that sort of boosts our immune system, and that's important. But the best way to kill a virus is to use a direct-acting antiviral small molecule drugs. And thankfully, that's what I've been working on for 25 years. So we're finally seeing our day in the sun. As a recent reporter from the Baltimore Sun said to me, oh, it must feel great hitting the pinnacle of your career at age 62. She had to out my age? Really? So here you can see some nucleosides. Now, I have worked on nucleosides my entire career, and there's a reason why. Because nucleosides have been the cornerstone of antiviral, anti-cancer, anti-parasitic drug design for many, many decades. And here you can see some of the more popular ones that some of you may even be aware of. AZT was one of the first nucleosides that was used for treating HIV. Acyclovir treats herpes. And you can see tenofovir, which is a very important acyclic nucleoside that's actually a component in almost every single drug cocktail that is used today to treat HIV and also treats HBV. And it not just confined to viruses, nucleosides also, as I mentioned, treat cancer. And here you can see some on the bottom of the slide that are active against cancer. So as I mentioned, I have been working in nucleosides my whole career. And a number of years ago, back when I was at Georgia Tech, we were working on a project that involved these expanded and extended pyrimidines and purine nucleosides. Sort of how far can we push Mother Nature? And I happened to be at a conference, and I was suffering through the worst, most boring talk I've ever been at. And I was sitting there, and I was doodling and trying to stay awake. And all of a sudden, I thought to myself, you know, if I hit this tricyclic nucleoside with the sulfur in it, with Raney nickel, that would pop that sulfur out of there, and that would keep those two pieces still stuck together, and they'd be able to move and rotate and you know, sort of move around and all that. And that was basically the birth of the Fleximers, and that's what I've spent my entire career on now since that time. And yes, this is my gratuitous picture of one of my 7 grandchildren. And by the way, she stayed that way for 30 minutes. I don't understand how. So anyway, she's probably mortified if she knew I showed this, because now she's 10. So anyway, so here's the Fleximers, and we first called these molecular chameleons. And the idea here was that, you know, and you can see there's 2 different basic scaffolds of the parent compounds, and we call these the distals, where they're connected at the bottom of the purine ring, or the proximals, where they're connected at the top. And the idea here being that, like a chameleon, a flexible drug should be able to adapt to its environment. Now, we know that chameleons, if they don't change color and blend in with the background, they get eaten. So we were hoping that our flexible drugs would be able to adapt to their environment, in other words, an enzyme binding site involved in the mechanism of action for a virus or whatever, and that they would be able to overcome this if the binding site mutated. And we're very aware of this today, because we all hear about all these different variants, particularly the Delta. And what happens is that binding site in the enzyme mutates, because it's figured out you're trying to kill it. And so it changes the interactions that your drug would be normally interacting with. And so what our drugs can do, however, is sort of move and sort of, as one of my colleagues put it, wiggle and jiggle in the binding site to retain their activity. It's also led to increased activity, as well as the ability to overcome these resistance mechanisms and variants, and also to exhibit activity against unexpected targets. And we've shown that they can do all of the above, including against SARS-CoV-2. One of our first early evidence as to this might actually work, we were working on an enzyme involved in a lot of viral replication. It's actually a host enzyme, not a viral enzyme, but it's important for the replication anyway. S-adenosyl homocysteine hydrolase. And this is actually an enzyme that only recognizes adenosine analogs. And what we found, to our surprise, was that this guanosine nucleoside actually served to be a very good inhibitor of this adenosine metabolizing enzyme. And this was, to our knowledge, to this day, the only G nucleoside that has ever shown that ability. And this is actually where the title of my talk came from, is bending over backwards, right? And what we found was there was an intramolecular hydrogen bond between the base and the sugar that then put the amino group up into the binding pocket where you would expect the adenosine to bind. And so we essentially created an adenosine mimic. And that was sort of the first of many, many successes that we've seen with these. And actually, this is, I'm particularly proud of. We hit the cover of this paper, this particular journal, Chem Biochem, last year, and this was a present from one of my previous graduate students. She had Tony Bainey, UMBC's glass blower, make a Fleximer out of glass. And this was TK's last paper. She was also a Meyerhoff student. And so I just wanted to show this. This was her last paper, and this was her gift, and we were really pleased that this got to be on the cover. So now back to, as I mentioned, in 2015, we started working on we had already been working on coronaviruses, but we published the first paper, the first report of a nucleoside analog being active in low micromolar activity against SARS-1 and MERS, and also human coronaviruses. And this was a fleximer that was designed after the FDA-approved acyclovir, which you saw a few minutes ago. This is a drug that is used to treat herpes viruses. It has absolutely no effect against coronaviruses whatsoever. And in 2016, we noted very potent activity against filoviruses, Ebola, Marburg, and Sudan. And again, acyclovir is inactive. And then in 2020, we had phenomenal activity, nanomolar level activity. That's what we all look for, is really, really low, against flaviviruses, including dengue, Zika, yellow fever, and tick-borne encephalitis. And again, acyclovir is inactive. And this really shows you the power of using the fleximer technology on these nucleoside drugs. So that brings us to today and SARS-CoV-2. And here you can see some of the nucleosides that are being looked at. Obviously, I think everybody in this room knows about remdesivir. And last week, Merck announced that they were seeking emergency approval for molnupiravir. And AT527 is also one that is being looked at. And favipiravir is another one. It doesn't start off as a nucleoside. It starts off as the base, but then is converted to the nucleoside in your body. And finally, our fleximers. And so what we've seen so far very quickly is that flexacyclovir, the protide, the McGuigan protide of this, we've done maximum tolerated dose studies with Dr. Bieberich in biology, and we see almost no effect to the mice, even after 10 days. And our newest analog, Flex AT527, and my grad student who works on this is actually sitting right over there. And he's very excited about this because this is even better than flexacyclovir. And we have a number of different pharmacokinetic and mechanistic studies currently underway. And we have very good activity, low micromolar activity against SARS-CoV-2. And they're going to be in animals, in infected animals in the next few weeks. And in terms of our next steps, commercialization, UMBC is great about helping you with commercialization. And to date, we've had 4 biotech companies that have expressed interest in licensing our fleximer technologies. And I took time out today to come give this talk, but I'm in the middle of 3 $15 million grant proposals that are due next week. And so if look a little tired, that's why, because I've been working on this nonstop. And then last November, I started my own company, Flexivir Biosciences, and that's now official. I haven't done anything with it, but it looks good, I guess, to be a CEO of something. And I wish I could tell you more, but of course time is short, and I have to give credit to all of my collaborators, all of the funding agencies, and of course my graduate students who do all the hard work, and my colleagues in the department and at UMBC. And I thank you for the invitation to speak here today.
It's my pleasure to introduce Dr. Earl Ellis, Professor of Geography and Environmental Systems at UMBC, where he directs the Anthroecology Laboratory. His research investigates the ecology of human landscapes at local to global scales toward informing sustainable stewardship of the Anthropocene biosphere. He teaches environmental science at UMBC and has taught ecology at Harvard's Graduate School of Design. His first book, which indicates there's going to be another one, Anthropocene, A Very Short Introduction, was published in 2018. So I was reading about this, and I was thinking to myself, wouldn't it be nice if it just went back a couple thousand years and had all those undiscovered, untouched places that you could you could explore, because who doesn't like to discover? But as I read a little bit more of the works and the quotes there, and this is, I don't know if I'll get this exactly right, Earl, but it says, areas untouched by people were almost as rare 12,000 years ago as they are today. So you have to go back pretty far to get something that was untouched. And then I started thinking, boy, we better act on Elon Musk before he gets up to Mars, and so we need astroanthroecology laboratories. So we're looking at the future here. So thank you very much.
All right, thank you. Yeah, I'd like to thank the whole UMBC research team for giving me a chance to come here today to present my research. And maybe my second book is on astroanthroecology. Never even thought about that till just now. So what I want to talk about today is very much what was just introduced here, the concept that the nature that we need to conserve in this human age is not a pristine, wild nature. The nature that we have today is a human cultural nature. And there's three things I hope that you leave here with by the time I'm done with my little talk. The first is that wilderness is a myth. The second is that nature actually needs people. And the third is that indigenous cultures are essential for sustaining biodiversity. So the classic way to look at the biosphere and the biodiversity of life is these natural patterns that you learn in kindergarten called the biomes. A good example, tropical rainforests, deserts, savannas. You're all familiar with these concepts. But as we know, we live on a planet that is increasingly transformed by human activity, right? We don't live on this planet that's completely wild anymore. We live in a human age, the Anthropocene. So these global patterns of biodiversity shaped by the long-term patterns of climate, the biomes, need to be thought of a little differently. And of course, we're seeing the transformation of, say, tropical rainforests into farms, agriculture, and other necessary types of land use to sustain human populations. But when we look a little deeper into the tropical rainforest, and this is an area of Amazonia that's been deforested, and what it reveals is a far deeper human history. A history, this is a 900 or I think more than 700-year-old geoglyph. This is a cultural earthwork built by earlier societies that was covered by forest growth following the Great Dying after the arrival of Europeans and their diseases. So we have a much deeper and more permanent human history of biology and biodiversity and ecology that we need to think about. And so in 2008, together with Naveen Ramankutty, another geographer, we coined the concept of anthromes, or anthropogenic biomes. These are the global patterns of life that are shaped by human societies, like farms, et cetera. And I'll get into this in a little more detail, but what I really want to talk about, the exciting work that we did together with a dream team, really pulled together a dream team of archaeologists, paleoecologists, geographers, indigenous scholars, and conservation scientists to look at the deep history, the last 12,000 years of human transformation of the biosphere using this concept of anthromes. So let's take a look here at our results. So we looked at 12,000 years. We divided this into 60 time intervals. I think the most important thing to look at right now is that we have two ways to look at this global history. One is, of course, a global map. The other way is this chart at the bottom that's showing the global area occupied by different types of anthromes. And in this particular illustration, you're going to notice on the left is the legend there. And you can see at the top you have these intensive anthromes. These are like cities or intensive agriculture. At the very bottom you have wildlands. Okay, that's familiar. These are areas that have no evidence, at least in our data, of having human populations or land use. And then you have these cultured anthromes. And these are low-density populations in general and areas without so much intensive agriculture. And when you look at the planet 12,000 years ago in 10,000 BC, you are seeing a planet that is not mostly wildlands. That was a really amazing discovery for us, that when you do the backcasting modeling that we did to reconstruct the biosphere 12,000 years ago, if you look there, that brown color, you can see the cultured drylands there, that's really the dividing line between the wildlands and the anthropogenic part of the biosphere, the human-shaped biosphere. You can see it there, and you can see it's about three-quarters of the terrestrial biosphere has been shaped into these cultured anthromes 12,000 years ago. That's the end of the last ice age. Okay, so moving forward, 2,000 years ago, and you can see that, well, there's not any more wildlands, are there? There's even less wildlands over time, not surprising. And what you're also seeing is that you're seeing more of these intensive anthromes, these croplands and dense settlements and other kinds of anthromes are starting to become more common. 1500, right before the Europeans arrive on the American continent, and you can see, look at in Central America, I'm just gonna highlight that. Look at Central America and look at that red color and the dark green and the yellow. Those are densely populated, intensively managed parts of the planet, okay? Like the Mayan civilization. There's 1600 CE, boom. Thanks to the influx of colonial diseases, just colonial disaster in general, you can see that that's more or less been wiped out. And it takes a long time before we see that kind of intensive, high density kind of management in some of those areas again. Now getting closer to home, 100 years ago, 1900, you can see we're getting near half of the terrestrial biosphere is now intensively used. And again, no more wildlands than before. And then finally, just our most recent time, 2017, you can see about 3/4 is still, it's actually more, it's more like 80% of the terrestrial biosphere is in these intensively used and cultured biomes, these anthromes, and you can also see that most of it is intensively used at that time. So there's this relatively rapid, recent decades and centuries, relatively rapid, intensive transformation of the biosphere. I should also mention that when you look at this, about 90% of a place like a tropical rainforest is actually a transformed, cultured anthrome landscape. Now, when we look at just the parts of the biosphere, we're just focusing here on the areas that have been prioritized for conservation. Key biodiversity areas, indigenous lands, potential natural areas as classified by some of the conservation groups, we see about the same thing, about the same history. It's not like there are these areas of the world where people have not been shaping the landscape for thousands of years. This is common across just about everywhere, especially key biodiversity areas look very much like some of the most transformed areas of the world. This chart's a little bit confusing, a little complicated, but look at that gold color, okay, and look at where that is. It's not at the far end of the graph at the current time, okay? This is looking at how the patterns of the human-shaped world, these anthrome patterns of the world, how correlated they were, how well they predict the patterns of biodiversity on the planet. And what you see is the historical patterns predict biodiversity better than the current patterns. Maybe some of this early cultural shaping of landscapes actually may have produced some of this biodiversity. In fact, that sounds kind of shocking for a lot of people, but in fact, this is the common knowledge of archaeologists and paleoecologists who study these biodiverse places like Amazonia. There are thousands of years of history of hunter-gatherer and farming societies shaping more biodiverse landscapes through different kinds of low-intensity farming and traditional hunter-gatherer practices. So believe it or not, there's good ways of thinking about how it is even possible for this to be true. Now, it's very easy to just imagine a tropical rainforest, gigantic areas of, for example, Amazonia, as just these kind of wild natural places without people. But I think anybody who knows any more about this goes to the ground and looks under those trees, you're going to see the people who have conserved and sustained and shaped the biodiversity of these places for thousands of years and are still protecting it now. Indigenous cultures protect, sustain, shape biodiversity. When we look at some of the most biodiverse landscapes of the planet, if we look at, for example, the Masai Mara, where people go to see these intact assemblages of megafauna that are rare everywhere on the planet, but in places like this. Well, this is not a wild place without any people. This is the traditional rangelands of the Maasai people, and they have cultured this biodiversity for hundreds of years, and also are protectors of this biodiversity. They are the solution, not the problem. Let's look at the deserts of Australia. Well, it took a while for people to figure this out, apparently, but in fact, the Martu people, for example, have been shaping biodiverse landscapes through fire, cultural use of small-scale fire that also prevents gigantic megafires like the ones they have in Australia now. They have been culturing this landscape for thousands of years. So when we think about biodiversity, we have to think about indigenous culture and the culturing of biodiversity. Indigenous cultures, even today, are widespread, especially in the places in the planet that are the most biodiverse today. So we need to think about cultural diversity as what sustains biodiversity. People are what sustain biodiversity. So we have to get beyond this kind of classic narrative of we have this wild planet with a balance of nature that is just being disturbed by people, and we have to get into the realities of this human planet where we really don't have this wild nature. We have a cultured nature, and the biodiversity we have has been shaped and entangled with human societies for thousands of years. And in this time of pandemic, when it's never been more clear to us how close we are to the rest of the biosphere, the world, the biological world is connected with us like never before, we need to really embrace this narrative for the biodiversity of the human world. Wilderness is just a myth, okay? Nature needs people, and indigenous cultures are what it takes to sustain biodiversity. Thank you.
First of all, one more round of applause for the first three speakers that we just had. I think this was awesome. We will take about a 5-minute break just to move microphones around, so don't go anywhere. We'll be back shortly and go into session number 2. Thank you. Welcome back again. All the mics have been switched. All the mics are working. The speakers are ready. I hope you enjoyed the first set of speakers, and I know you will also enjoy our next round that's coming up. Very quick introduction. It's really a pleasure of mine to introduce the moderator of our second GridX session. Dr. Kimberly Moffitt is the interim dean of our College of Arts, Humanities, and Social Sciences. Please give her a hand, please. Kimberly Moffitt.
Thank you so much. I have the pleasure of introducing first Dr. Andrea Klein-Smith, who is an associate professor in the Department of Information Systems here at UMBC, as well as the director of the Interactive Systems Research Center. Her research in human-computer interaction and effective computing investigates the relationship between affect and interaction in training contexts, examining both individuals and teams to develop interactive systems that promote affect awareness and self-reflection. It was a lot for the humanities professor to say and understand. But what I loved is even after looking at all of that, I realized how much of what Andrea is doing is very much connected to some of the work that I also do in the communications world. Prior to joining UMBC, Dr. Klein-Smith was a postdoctoral researcher at the University of Florida, as well as Goldsmiths University of London in the UK. She received her PhD in computer science from the University College London in the UK, and her master's in science in computer science from the University of Aizu in Japan, and a BA in psychology from the University of Oregon. Please welcome Dr. Klein-Smith.
Good afternoon, and thank you for being here. I'm really excited to share some of my work with you. I was introduced, my work is on designing interactive systems to support stress awareness and reflection. So I'd like to share a personal story to give some insight to my work and how stress affected my performance. So after my first psychology class in high school, this is me at 16, I noticed the hair. I thought I really wanted to be a counselor, and so as an undergrad, I signed up to volunteer for a crisis line. And I'm really excited to get some experience and training toward this goal. And crisis line, right? So after I signed up, I went through this training program. It was about a month long, and we simulated some calls and practiced how we should respond. And we got some verbal feedback from the trainers, and then we kind of went on our way. Training program ends, I begin volunteering, and after about a month in, I got my first serious call. And I panicked. My stress just completely went through the roof, and I forgot everything that we had learned. Fortunately, however, there was a professional there. We were partnered with a professional who was able to seamlessly take over, fortunately. After the fact, he shared with me that my reaction was not unique. It was something that he had seen many times before. So I came away from this experience with an understanding that in addition to the obvious importance of developing the skills and the knowledge that's required for the job, it's also really important to address the affective experience and the affective impact of the work, the emotional impact of the work, because how we respond in these situations can be, have some serious consequences, right? And a little bit of a spoiler, I did not pursue counseling as a career, hence the computer science degrees. But I continue to work in this area. So what happens when we experience stress? So most theories agree that there's some stimulus, right? So for me, it was a phone call that results in external and internal changes in the body, right? So we might have some facial expressions, body expressions might change. Internally, we experience changes in our physiological responses due to our autonomic nervous system activating, right? So we might start to sweat more, and this is our electrodermal activity. So now let's take this training situation where we have paramedic teams in emergency response training. So before we can start designing systems for paramedic trainees, which are important for them to be able to visualize and identify the experience, the stress experience that they're undergoing, we need to be able to understand the dynamics of the team, what's happening during the interaction. And one dynamic of team interaction is physiological synchrony. And this is the response, the dynamic linking of the physiological responses between two or more people. And we know that this happens in a lot of different contexts, in a lot of different interactions. And what we don't know is what's happening during the simulations and what in terms of when they're in synchrony and when they're out of synchrony. So to get a bigger picture of this, we're developing a model of physiological synchrony that uses the trainees' sweat response, so their electrodermal activity. So this is during their simulations. And this model gives us a continuous measure of their physiological synchrony throughout the entire simulation. And you can see that it fluctuates, and we know that people go in and out of synchrony. But what's happening here in these high periods and these low periods? So another dynamic of team interaction is communication, right? So we're in looking at the communication that's occurring during these high and low periods, we're seeing an inverse relationship. So that means we're seeing more communication, and the trainees are perceived to be experiencing more stress when they're in these low synchrony periods. And the conversation that's happening is a little bit more combative between teammates. Whereas in the high synchrony periods, we're seeing less communication and a little lower perceived stress. And the conversation is a little bit more helpful. The teammates are offering help to each other a little bit more, indicating a greater cohesion within the team. So in designing the stress awareness system, which you see here on the right, it allows trainees it's providing them with their contextualized training data for them to make sense of and to be able to identify and understand their experience and to tie specific events that trigger stress to specific interaction behaviors. So this system provides both their verbal information as well as visual information for them to reflect on, as well as their external behaviors and some internal information from their electrodermal activity. So the trainees see their own response, they see a measure of their team's response, and then they see a measure of the entire cohort's response as well, which allows them to place themselves within the larger group and get an enhanced picture of the relationship between them, their connections, right? So we're getting a sense of how they relate to each other. And they can use this to reflect on their experience. So in evaluating this system from a related project and from theory, we expect that the system will actually facilitate deeper reflection than than without the system. So just in reviewing and reflecting on the experiences without the system, we expect the system to provide that greater sense of deeper reflection, because we know that instructional technologies that split the incoming information between the verbal and the visual channels makes use of both processing systems, allowing for more of the cognitive resources to be used, which reduces the mental effort required to engage in reflection. So the last connection that I want to stress here is the connection between my research and its theoretical underpinnings. In order to understand our individual experiences, we need to be able to see ourselves as elements within a system. And the systems that I develop allow users to reflect on themselves as interconnected parts of a whole, and provide an extra dimension of awareness that's necessary for achieving a deeper understanding of oneself. So thank you, and I want to say thank you to my collaborators and my connections in this project. Thanks.
I could actually follow it and enjoy the talk, Dr. Kleinsmith. Thank you so much for giving me the opportunity to see the blending of how our STEM disciplines, as well as those of us that are working in the humanities and social sciences, actually can see how these systems work together, dealing with actual human interactions and context. So I appreciate that. Not sure I'm going to be able to say the same about the next speaker. Because this is very far from any aspect of what I deal with or talk about. In fact, I was on this stage 3 years ago as a faculty member giving a talk about Disney princesses, so I'm a long way away from what Dr. DeMose will talk to us about. But because I love him and enjoy the interactions that I've had with him as a colleague for a number of years, I am still quite pleased to be able to stand before you and introduce him. So Dr. Belay DeMose is a professor of atmospheric physics and the director of UMBC's Joint Center for Earth Systems Technology, also known as JCET. Dr. DeMose started out with a bachelor's in science and nuclear physics, but made a switch to cloud seeding when he witnessed the results of the 1984 Ethiopian famine, a result of a natural temperature change, but exacerbated by government policy. He spent his time researching cloud seeding over the Sierra for his PhD work, and has worked at the University of Illinois, NASA, as well as Howard University, and of course now here at UMBC. Dr. DeMose is a fellow of the American Meteorological Society and is a member of many educational and civic organization leadership. He initiated and currently leads the only university-operated reference upper air measurement site certified by the WMO. Please let's welcome Dr. DeMose.
Thank you. Good afternoon. I am Belay DeMose, professor of physics, but I have no equations, nothing to show you. But the talk before me was about stress, and imagine the stress I had. Okay, so what am I going to talk to you about today? Today, I'll talk to you about starting. Start small, but start. It's a story about close to my heart, about a station in Beltsville, Maryland, doing climate observing stations. So earlier we had a geography talk about Anthropocene. So I'll take you back 20,000 years. Ice Age, a very nice sweet spot where we all lived for about 10,000. And the last century, you see it warming. Okay? Now, that's in the news. And you just heard last week that the Nobel Prize was given to atmospheric physics, to a couple of guys who modeled how the atmosphere was changing. And the change is 0.1 degrees centigrade in a decade. But over a century and a half, it's about 1.5. So which way are we going? That's where the debate occurs. So, and if you've been watching your news, ice is all melting, floods, hurricanes, you've seen all of that. And even the nighttime on September 22 this year, it was a climate night. Lots of climate talk, and everyone has an opinion. I'm not going to talk about those opinions. But I'm going to choose two things. One, the grid it takes to measure that 0.1 in 10 years. And number one, to remind you, there is a station in Maryland that's going through everything to measure that accurately. 0.1 is at the surface. 0.1 degrees C is at the surface in a decade. So per year is 0.01. And you have to do this globally, and you have to be consistent, and you have to do it through the entire atmosphere, all 40 kilometers of it. The easiest thing is the simplest. Put a thermometer on a balloon and release it. And that's what we do. And that is the best measurement that we have. However, there are many vendors and many errors. Some vendors want to maximize profit. So as you measure your temperature, your humidity, you get a lot of data. So I show you the curves that you see is relative humidity of 5 vendors. All those students that you see are undergrad interns. We put this on a balloon, 5 different vendors. They give you so many different data sets. Which one do you believe? And I told you you're looking for 0.1 degree in a decade. So you have to check for accuracy and precision. And unfortunately, in 2006, many of them were not that good. So you have to define sensor quality performance, standardize everything. Many countries, many vendors, many errors. We say buy American, buy Russian, buy Chinese, buy Indian. Look at those colors. Those are all nationalism playing havoc on the data. So you need to go through every instrument and try to see anchor data sets. Okay? Well, you can use the best station. The Lindenberg, Germany, have done it for almost 100 years. But unfortunately, there are different managers buying different instruments. This is the trend at 8 kilometers. You see the curve is jumping up and up. It's not change, it's instrument introduced. Well, so what do we do? Now you have to do this from the surface all the way up, which means, I show you in here the box and whiskers error bars. Those are from actual measurements that we think are correct. Models, satellites are all over. But at the surface, that star is that 0.1 degree that you see, and you did notice it. Up high, it's cold. When you're hot at the bottom, you try to ventilate at the top. That's Earth's physics explains it. Okay, So do we keep going with different sensors, or do we tell the companies to shape up? So in 2008, this global climate observing reference station came into being. It's called GRU-1. And the idea is do not accept black boxes, do not accept proprietary software, do not accept, disregard any systematic effects. So just make sure transparent, uncertainty defined, and make it traceable. It's an interesting idea. And that is what the UN under the Weather Meteorological Organization, WMO, started doing. And there's only one station that's operated by a university, and it's in Beltsville in Maryland, who operated through collaboration with Howard University. Dean Moffitt, that's your place. And imagine, it takes about 4 hours to send this balloon all the way through. So every week, between 1 and 5 a.m., there is a student launching this and waiting there. For 13 years, 52 weeks a year, and counting, okay? Start small, but start anyway. So I showed you the graph from 2006, and I show you 10 years later. At the bottom, you see how all those vendors match. So if you show them their error, they will correct it. But what makes me happy is when I show you that picture in the middle. Every student there is a PhD now. So that is close to my heart. And of course, I lead NASA centers. And of course, there are many satellite fleets over there measuring globally. Again, many vendors, many satellites, many countries, you got it. And Beltsville is the designated calibration site. So, when I hear a lot of those talks, opinions, there's one poor scientist measuring and making you watch. Thank you very much.
The third speaker in this section is actually a colleague in the College of Arts, Humanities, and Social Sciences. So I'm very pleased to be able to introduce to you today Dr. Zoe McLaren, who is an associate professor in the School of Public Policy at UMBC. And she's also an affiliate of the Health Econometrics, thank you, and Data Group at York University. Dr. McLaren is a health economist whose research informs health and economic policy to combat infectious disease epidemics, including HIV, tuberculosis, and COVID-19 in the US and abroad. Dr. McLaren develops rigorous applied statistical approaches to answer important policy questions using real-world data. Her work builds the evidence base in 3 key research areas. First, the impact of health and economic policies to fight HIV, tuberculosis, and COVID-19 globally. Also, the relationship between the access to health resources and economic outcomes, and finally, the causes of persistent poverty. If you have an opportunity, Dr. McLaren has been quite busy during the epidemic or during the pandemic in terms of keeping many of us informed about what's happening with COVID-19. So following her personally on Twitter at Zoe McLaren, but also reading her very well-received New York Times op-ed pieces, I would encourage you to look into what she's talking about, how she's talking to us about COVID-19, and making sure that we are informed rather than misinformed about this particular pandemic. Let's welcome Dr. McLaren.
Good afternoon, everyone. I'm trained as an economist and a statistician, and my work is designed to leverage data and statistics to guide infectious disease policy. I vividly remember the last class I taught in person before going into lockdown before the pandemic. We knew the pandemic was coming our way, but we didn't know what that was going to mean. So I decided to teach my graduate statistics class 2 very technical mathematical concepts to help them make sense of what was going on. And I was pretty surprised when about a week later, I saw all of my friends sharing these same 2 concepts on social media. And I'm pretty sure they're familiar to all of you as well. The first is exponential growth. This tells us that a small number of cases can quickly grow into a major outbreak. And the second was flatten the curve. That showed us why slowing transmission was important to make sure our hospital systems were not overrun. These 2 examples show the value of math for understanding pandemic policies. Math provides a powerful framework for making sense of what we can see and what we can't see. It helps us predict the future so we can make a plan. And it also helps provide evidence for some policies that might seem very counterintuitive. We learn when studying exponential growth that the optimal action often looks like an overreaction because cases are growing so quickly. It tells us why it's important to prioritize the elderly for vaccination, even if that might slow the vaccine rollout down a little bit. It tells us that we should be paying people to get vaccinated to make sure our vaccination rates are high. And that we should be using inexpensive rapid tests in addition to lab-based PCR because they're better for controlling transmission. So one big challenge working with mathematical modeling is that it risks being out of touch with reality. So I try to make sure that my work is grounded in the real world. Before COVID, I worked on 2 other infectious diseases, HIV and tuberculosis. And I spent a lot of time traveling to places like Africa and India, where I followed doctors around as they treated patients in healthcare clinics and in hospitals. And I spoke with lab technicians about how they interpreted the results of diagnostic tests. And I met with an awful lot of patients. I took a lot of notes, and I asked a lot of questions. I asked things like, what are your biggest challenges? How do you make decisions? What information do you wish you had access to? And then all of these conversations helped me formulate the goal of my research, which is a policy question that needed an answer. And then I would find available data and needed to build evidence to be able to answer that question. And it wasn't always easy. I often had to build a bridge between the data that we had and the question that we needed an answer to. Math to the rescue. The bridges that I build are based on statistical methods, they're based on mathematical models, they include real-world insight and a big dose of creativity. But what does that look like in practice? Let me tell you about one of my projects on drug-resistant tuberculosis in South Africa. Drug-resistant TB can be complicated to diagnose. The tests can be unreliable, and they're often not even performed because of budget constraints. So that means a lot of cases are going undiagnosed. There was one data source available, and it was of questionable quality. So I needed to figure out how I could leverage that data to answer this important question and figure out how many cases were going undetected. So I took 3 different statistical methods, combined them together, and adapted them for this specific purpose. And we were able to find that 20% of all drug-resistant tuberculosis cases that were already in health facilities were going undetected. 20%, 1 in 5. So we managed to leverage this questionable data set, this data of questionable quality, to produce compelling evidence that healthcare systems needed to figure out a way to start testing a lot more patients. Now I work on COVID-19, but I'm still really worried about cases that are going undetected. Rapid antigen tests are a really powerful tool for helping us detect cases early, and we should be using them a lot more in addition to lab-based PCR testing. Rapid tests have several advantages over lab-based PCR. They're designed to detect infectious cases. That means cases that are at risk of being transmitted. They're available at home, so that means more people can get tested. And you get your results in 15 minutes, so we can catch cases a lot more quickly. They're pretty inexpensive, which means we can test a lot more often. And it turns out that frequent testing actually more than makes up for any decrease in accuracy from these less expensive tests. We want to think about how rapid tests can be powerful. Let's look at the math. So here we're thinking about all of the infectious COVID-19 cases. These are cases that are at risk of being transmitted. Rapid testing, we understand, identifies about 95% of those cases correctly. So 95% are going to get that positive result. But that means 5% of them are going to get a false negative result. That means they're going undetected. That's not a good outcome. Can we do anything about that? It turns out, if we do the test over again the next day, then 95% of that 5% get the correct positive result and are detected. And that leaves us with just 1/4% that have a false negative and go undetected. So we can use frequent testing to make up for the accuracy issues. And what we want to do is make sure that rapid testing is widely available to everyone. Our current president understands that and has allocated just this last week $1 billion to buy rapid tests. We want them to be easily available to everyone. We want them to be inexpensive or free so that we can test frequently and keep cases down. The beautiful thing about frequent testing is that we can boost a test that has 95% accuracy rate up to a 99.75 accuracy rate just by testing a second time. Decision-making that combines real-world expertise with insights from mathematical models can be really very powerful, and it can be the key to getting us out of this pandemic. I want to leave you all with one final point, and it's about the most simple mathematical calculation of all. When it comes to slowing transmission, every little bit of effort makes a difference, no matter how small, because it all adds up. If we can work together, we can make it nearly impossible for the virus to spread, and we can put the end of the pandemic within reach. Thank you.
So again, our second session is over. Another hand for all our speakers in both sessions now. And give us about 5 minutes to do another mic change, and then we'll go into session number 3. Thank you. Welcome back again. Now we know how much time it takes to go to the bathroom. In an UMBC talk, that would be pi, right? 3.1415 minutes. It's a very old math joke. Anyways, our third session, as you see, has originally scheduled 3 speakers. And when we started planning for this year's GoodX event about 6 to 8 months ago, we kind of knew being in a pandemic, we didn't know what the fall would look like. We might encounter some logistical challenges. I'm really very thankful for all of our speakers who've been preparing very diligently for today's event and committed to make today a success. But as you go into such a complex event with some of our colleagues, alumni potentially flying in from California, we found out that in the end we encountered a few challenges that were out of our control. So therefore I am disappointed to share that our alumnus Sankarshan Murthy, who got his degree from mechanical engineering in 2006 and is now the CEO of Bumblebee Spaces. You should check that out. It's actually really, really cool stuff they do. Just could not, we were not able to bring him in today, and we might be able to do that at one of the upcoming GoodX's. But with that said, before I hand it over to our next moderator, I want to give a thanks to all the audiovisual and the event management staff and teams that are here. There's a lot of people all in the black shirts. If you can give them all a hand, they really are the ones that made a lot of this possible today. And with that, I want to welcome our third dean, and that's Dean Keith Bowman, the Dean of the College of Engineering and Information Technology. Keith, take it.
Thank you, Carl. Dr. Carissa Chia is a professor of psychology and an Asian Studies faculty affiliate at UMBC. She utilizes mixed method approaches to explore how individual characteristics, relationships, socialization, agents, and contexts interact to influence social, mental, and physical health. She is particularly interested in understanding these processes among families from ethnic, racial, religious minority, immigrant, and marginalized backgrounds. She received one of the very first NSF Rappert Awards on COVID impacts in collaboration with Professor Shimai Pan from UMBC's Department of Information Systems. That project is focused on data mining on public information to assess bias against Asians. Dr. Chia is a fellow of the American Psychological Association and of the Association of Psychological Science. Unfortunately, Dr. Chia will not be able to join us in person due to some family health emergencies, but she has recorded a wonderful GoodX talk for us to watch, so watch it with me now.
One of the major tasks for parents in all cultures is to raise children to be culturally competent members of their society. On December 1988, when I was 14, my family got on a plane in Kuala Lumpur, Malaysia, and arrived in Toronto, Canada. My parents were about the age that I am now. When I think back to that time, I wonder what it was like to be my parents, to have raised their children for about 1.5 decades in the Malaysian cultural context, and 23 hours later be faced with that task now in the Canadian cultural context. There are many different definitions of culture, but culture is usefully conceived of as a set of distinctive patterns of beliefs and behaviors that are shared by a group of people and that serve to regulate their daily living. Therefore, culture is both big and abstract, but at the same time, small and personal. These beliefs and behaviors shape how parents care for their offspring, and these unique patterns of caregiving are a principal reason that individuals in different cultures are who they are, and sometimes differ so from one another. So when we all talk about parents raising children to be culturally competent members of their society, at the heart of this statement lies some of the following questions. What do these competencies look like? And what are the best ways to help children develop these competencies? Using a cultural approach to parenting science, we should also ask, are the answers to those questions the same for parents in different cultures? What do these parenting beliefs and behaviors look like across different cultures? And Do these parenting beliefs and practices have the same meaning? And therefore, do they lead to the same outcomes in children across different cultures? To answer these questions, we use a variety of methods such as surveys, interviews, focus groups, observations, and experiments to study families in different parts of the world and across different ethnic and religious groups within the United States. In this presentation, I would just focus on Chinese families in the US. Let me share one example briefly on a seemingly simple aspect of parenting: warmth. Parental warmth is defined as the affection, care, comfort, concern, nurturance, support, or simply love that children can experience from their parents. Parental warmth contributes to all sorts of positive outcomes in children across different parts of the world. At the time we conducted the study, however, there was a lot of talk about Chinese mothers as tiger mothers. These moms were thought of as cold, unloving, and harsh. And in fact, some research studies using surveys found that Asian and Asian American mothers scored lower on levels of warmth than their white counterparts, further fueling this image of the Asian tiger mother. However, some of us argued that there was a problem with how these mothers' warmth was being measured. The surveys mostly asked about ways of showing warmth that were based on previous knowledge derived from samples of white European American mothers. These practices tended to focus on outward, expressive, and direct ways of showing warmth. So, these surveys were less suited to capture the parenting of mothers from other cultures, resulting in a poor understanding of parenting in these cultures. So instead, we interviewed Chinese American and white American mothers about their beliefs and understandings of warmth and affection and how they showed their children that they loved and cared for them. So what did we find? First, compared to their white American counterparts, Chinese American mothers equally valued showing their children that they loved and cared for them, countering the cold tiger mother stereotype. Both groups of mothers also similarly talked about spending time with their children as a primary way to make their children feel loved and cared for. However, where they differed was that Chinese American mothers as a group were less likely to use outward, direct ways to show warmth or affection, like hugging, kissing, and saying "I love you," due to traditional cultural values of modesty and restraint. Instead, when asked about the ways in which they showed their children that they loved and cared for them, these mothers were more likely to discuss indirect ways. That is, what they do for their children, such as cooking their children's favorite foods, making sure that they were warm, and guiding and providing teaching and learning opportunities for their children. We found this to be true for Korean American mothers, as well as mothers in Japan, China, and Malaysia. We also extended our research to Turkish and Sicilian mothers. And overall, when we used culturally sensitive ways to measure parenting, we revealed both shared and unique parenting beliefs and practices across cultures that were tailored to that particular cultural context. So for immigrant parents, this picture is even more complex. These families must navigate multiple contexts simultaneously. In addition to their heritage culture and their host culture, immigrant parents also navigate the acculturation process, which is the process of cultural and psychological change that takes place as a result of contact between cultural groups. So going back to my parents, they, like many immigrant parents, adapted their parenting. There were aspects of their heritage culture that they insisted we maintain, such as ways of addressing our elders, But they also incorporated new practices that were more normative in Canada, like allowing us to go on sleepovers. These may appear like simple behavioral changes, but they underlie shifts in core beliefs about balancing children's interdependence and autonomy to better match the demands of the new cultural context. Immigrants are also parenting within the immigration context of their host culture, which is shaped by, among other things, the immigration policies and racial landscape of the host culture, where they are now minorities. During the COVID-19 pandemic, this fourth context featured itself more prominently in our research. Building on our existing work with Asian immigrants, we responded quickly to study the experiences of Chinese parents and children in the US in light of the spike in anti-Asian xenophobia. Many of these parents express fears and discuss having to modify their parenting to help their children navigate the racialization of the pandemic. Parents and youth both reported high rates of discrimination experiences and shared how these impacted their sense of identity, belongingness, and their mental health. For example, some parents engaged in socialization to help their children find racial pride and strength from their cultural heritage and to engage civically to readdress the inequities and unfair treatment. Whereas others passed on messages to children that they needed to conceal their ethnic identity and selves to avoid being victimized. We're studying the long-term outcomes of these different practices currently. So why are we interested in these questions? From a scientific perspective, a cultural approach to parenting science is invaluable for revealing the full range of human parenting, which can then guide the development of more inclusive theories. From a practical and social justice perspective, inclusive theories can inform intervention programs and policies that support all children to achieve their full potential as socially competent and valued members of society. The research is clear that multilingual and multicultural children are more flexible, resilient, and better able to navigate different spaces than their monocultural peers. All families living in multicultural and diverse societies like the US have the gift of being able to step outside our cultural lenses to learn from, share with, and support each other to have fulfilling parenting experiences while raising multiculturally competent children who thrive in a global society. Thank you.
I was asked recently if I could define inclusive excellence. And when I first watched that video, I decided that would be one of the first links that I would share. Dr. Upal Ghosh is a professor in chemical, biochemical, and environmental engineering. He's an internationally recognized leader in environmental engineering with a focus on understanding the fate and transport of toxic chemicals such as pesticides, flame retardants, and mercury. He investigates how they enter the food chain and the detrimental effects on humans and the ecosystem. His work has not only advanced the science of environmental research, but most importantly, he and his collaborators have been able to develop radical new approaches that are transforming environmental assessments and remediation. Dr. Ghosh is a co-founder of 2 startup companies that are transitioning novel remediation technologies to application. And recently, he received yet another grant in an amazing track record of NIH R01 funding. That project is focused on bioremediation techniques of halogenated compounds. Dr. Ghosh.
Good afternoon, everyone. And it's so nice to be able to speak in a real audience. It's been a while since I have done that. And so thanks for everyone who came here and also the audience that's online. So I was asked to talk about my research, and I decided to talk about some of the work we are doing on toxic pollutants in the environment. And many of you are aware of some of these chemicals that are out there in the environment, especially in the water. And the ones that I focus on in my work are these pollutants that come from past discharges. We banned them many years ago. Some of these chemicals were banned 50 years ago, but they're still out there in the rivers, and they go up in the food web into the fish, which some of us may like to eat, or the wildlife might get exposed to these chemicals. And in the bigger picture, this is an issue of externalities that didn't get internalized in our practices back then. And somewhat similar to what we are facing today with the issue with global climate change. The externality with carbon emissions are being passed on to future generations. And in this case, this is our previous generation. In the 50s and 60s, when we saw the heydays of industrial activity in this country and many of the other industrial countries, we ended up releasing some of these chemicals, which became an externality at that time that we are having to try to deal with today. So they continue to pollute our rivers, major ecological damage, and also potential human health impacts from exposure to these chemicals. We can measure some of these chemicals in human blood, human breast milk, and figure out the risk that's being caused to the population. And there are many fish consumption advisories, for example, in the waters in Maryland, and coming from some of these bioaccumulative pollutants that we have released in the past. And you see the picture on the right in your screen there of the advisories in Maryland. Some of these rivers, many of these rivers, have these advisories with colors coded red, where the fish you are not supposed to eat because they have too high a load of these pollutants that came from the past. They're not being released today. So in my research, I look at what these pollutants are, how they are still getting into the fish. And once we understand these pathways of exposure, we can start thinking about interventions, and that's where our engineering comes in. But the science comes first in terms of understanding who they are, how they are behaving in the environment, and what we can do about solving the problem. So the last one we do is how to reduce the impact from these pollutants. So one of the things managers do for sites that are contaminated is put out signs like the ones that you see here. They're effective to some extent for people who would read those signs and act accordingly. But then you see right behind those signs, these signs were actually in this river, which is in the western part of Baltimore, and you see kids catching fish. And there's a lot of people who would catch the fish and eat them. And the impacts are much greater on underprivileged communities where they may not be aware of these advisories, or they have to catch the fish to bring it to the table. So there is a huge impact in terms of who the impacts are being imposed on. And then beyond the human impact, there are these other impacts where we have this bird. This is a fish-eating bird. I took this picture in Virginia Beach earlier this year. And of course, there is a pop quiz now for you. So who can identify the bird here? There we go. Wonderful. There is bonus points for identifying the fish. So who can identify the fish? So it started off as a bird watching trip for me and ended up being a fish watching trip because this osprey, there were a bunch of ospreys that were breeding, and so they were bringing this fish back from the ocean into the nest, and I saw a glimpse of the diversity out there in the waters. So this one is American shad. It's an anadromous fish. It lives in the Atlantic Ocean, but comes up through the Chesapeake Bay into our waters to spawn. And an interesting fact is that it comes back to the same river where it was born. It's quite amazing they do that. And as they come up in these rivers, in the coastal waters, they get exposed to these pollutants, which they then pass on to whoever is eating them, including these fish-eating birds. At the heydays of when these chemicals were released, and these are classes, the class of chemicals that bioaccumulate in the fish are things like pesticides, like DDT, a range of flame retardants, and the impacts are seen more heavily on the top predators of the system. That's where they bioaccumulate a lot. And we nearly wiped out the population of some of these birds, like the bald eagle and the ospreys in this country. And it's made a big comeback because we clamped down on the releases of these chemicals. So we study these chemicals. So one of those chemicals that we study are called polychlorinated biphenyls. And these are flame retardants. They had great chemical properties. It would make an oil not catch fire, which was great. It was used heavily in transformers and capacitors where you need an oil to act as a heat transfer fluid. But you can imagine when that transformer is not acting quite right, or you draw too much power through it, it heats up, and that can cause an oil fire. So Monsanto came up with this wonderful chemical that you could add to that oil and not let it catch fire. But it's left its legacy. We're not able to internalize or even conceptualize the cost of this chemical in terms of the damage it would cause to the environment later, which we're trying to deal with now. For example, General Electric spent nearly $2 billion cleaning up parts of the Hudson River, and they're not done yet. And that's the cost that's being borne by the industry and sometimes the federal government and us through our taxes today. So that's how some of these externalities get passed on to the next generation. So we, as part of our research, we start with understanding the problem. So I explain it to my students. The first thing and the most important thing you need to do is to be able to define the problem right. So we spend a lot of time doing that first. To be able to do that, we have to understand the science behind it. And you can imagine when you're talking about these chemicals going up the food web into the osprey, there are a lot of these steps involved. There are chemical steps involved in terms of what you see on the right, on the left of the screen there, of how these chemicals that are now buried in the mud is slowly making its way into the water, into the little organisms, the plankton and the algae and the little fish, and how it goes into the big fish and into the osprey or the human who catches and eats that fish. But it's a measurable quantity, a measurable process if we do the right measurements. So a lot of our work goes into doing the measurements right so we can define the problem. And then the next step is in defining the problem is being able to understand not only the direction of these arrows, but quantifying those arrows. And then linking that with human exposure and risk. And once we get that picture right, we can bring in the intervention and cleaning up. So here are some pictures of some of the work we do. This is in the Anacostia River, supported by Washington, D.C. government, trying to understand the problem in the Anacostia River, which is polluted. D.C. wants to clean it up and make it fishable and swimmable. Before we can do that, we have to get rid of the pollutants that are in the river, figure out where it's coming from, and then address those sources. So our students are working, we have been working there for nearly 4 years now, and we are trying to define the problem right. We are doing measurements in the water, measurements in the fish, measurements in the air phase, and building up these models that describe how these chemicals are moving around in that system. So as I said, building these models, one of the key things we do, once we do these measurements and understand what these chemicals are, what concentrations they are in different phases, we then have to describe it mathematically. So in the work we do in engineering, we have to understand the science well enough that we can describe it quantitatively through math. And once we are able to do that, we can do projections, we can simulate interventions, and we can choose the intervention that will give us the best outcome in terms of reducing risk either to the human population or to the osprey, whatever is being impacted. So that's what we do. We do these measurements, we link it up with models. Our models are physical models of how water moves, how chemicals move, and also biological models of how organisms behave. Who eats who is the big question in trying to understand, for example, in the food web, how does it go up into the American shad? And then once we get that picture right, we think about how do we manage these types of sites. So the picture you see on the right here is me with students sampling in one of our sites in, this is Fort Eustis, Virginia, where we have a beautiful wetland teeming with wildlife, but it's contaminated with that chemical, polychlorinated biphenyls. So we did a set of measurements, we figured out what's causing the problem, we came up with solutions in the lab, and then we are transitioning some of those technologies out into the practice. So in the next slide, I'll show, we started off with looking at understanding how these chemicals which are buried in the mud from the past releases are getting into the food web, into the water, and what can we do to change the geochemistry to be able to reduce that process of transfer. So you see a PhD student, Hilda, there working with a postdoc on a set of aquaria where we are studying these small systems in small aquaria. How do these chemicals go up in the fish? What kind of interventions we can do to reduce that uptake? Once we figure that out, we can build our models to transition that into looking at what will happen if I do it in a lake. So the lake becomes the aquaria now. And we did that through multiple studies. We demonstrated that we can actually make a change to bind up the pollutants strong enough that it doesn't go up into the food web with the right kinds of amendments into these sediments. And the picture you see here on the right here is one of the sites where they are actually using it at a commercial scale. This is being done by the Navy in Hawaii, where they're cleaning up a marina using one of our technologies. And the ultimate goal there is to be able to finally reduce that exposure, reduce the pathways of exposure into the food web so that the top levels of in the food web, the predators and human beings who end up eating the fish are not impacted by these chemicals. So it starts off with understanding the science right, being able to describe that science quantitatively using math, and then simulating types of interventions and engineering approaches that would be suitable to reduce that exposure to make it better, make the environment better and make it more livable. So with that, I will end my talk. Thank you.
So 9 speakers at GridX, and I'm sure none of you were aware of all the different type of work that's ongoing here at UMBC. Again, I want to thank all our speakers. I want to thank the moderators. I want to thank all the AV team, the photographers that I see up front here. But most importantly, I want to thank you in the audience, either remotely or right here in the room. And those of you in the room, I'm sure you've heard that there is a photo op with President Hrabowski in about 20 minutes at 4:30 in front of the library. And we want as many retrievers with Dr. Hrabowski as possible. So really looking forward to that photo. And I hope to see all of you back here a year from now at the next GridX. Thank you very much.